Hi everyone, I'm Ricardo Gonsalves and welcome to the Prostate Cancer Foundation of Australia's Ask the Experts webcast on prostate cancer survivorship, the long run. On behalf of the PCFA, thank you very much for joining us. So over the next hour, we'll be taking a closer look at what it means to be a prostate cancer survivor, give you the tools to manage the challenges associated with it, and walk through the 7 key principles in addressing and making a difference in prostate cancer survivorship. Now, COVID-19 itself has thrown up some challenges, but also some opportunities. So we here at the PCFA looked at the opportunities for this webcast, and we found them in doing a webcast which draws on expertise from people from all over the world. So our guests come from New York, Vancouver, Perth, Adelaide and Sydney. And upon registration, we asked you for some of your questions and we've used them as a guide for our discussion today. So we'll be able to answer some of them specifically. And while we wait for more people to join us online, let me introduce myself and the panel. My name is Ricardo Gonsalves. I'm a presenter on SBS World News and finance editor for the network, and I've moderated a number of these panels, which you can find in the videos section in the online community page on the Prostate Cancer Foundation of Australia website. And today's panel includes Professor Jeff Dunn. He is the CEO of the Prostate Cancer Foundation of Australia. Jeff has dedicated his life to cancer support with a 30-year career in research and non-profit leadership and holds positions at the University of Southern Queensland, West Moreton Hospital, Health Services Board and the Union for International Cancer Control. He is internationally recognised for his work on the social and behavioural aspects of cancer control, including the continuum of research, prevention, early detection, supportive care and quality of life. Professor Robert Newton, exercise physiologist at the Edith Cowan University in Perth. Robert's major research directions include exercise medicine and rehabilitative cancer therapy to reduce the side effects and enhance the effectiveness of surgery, chemotherapy, and radiation therapy, among others. He's published over 800 scientific papers and attracted more than $36 million in competitive research funding. Dr. John Olive, Professor and founder of the Men's Health Research Program at the University of British Columbia in Vancouver, Canada. Dr. John focuses on masculinities as it influences men's health behaviours and illness management and its impact on partners, families and overall life quality. Professor Bogda Kozwara, medical oncologist at Flinders Centre for Innovation in Cancer in Adelaide. Bogda established one of the first cancer survivorship care programs in Australia that has been supporting patients at Flinders for over 10 years. She leads a cardiovascular disease in cancer research program at Flinders University and is a convener and lead of an international collaboration global partnership on self-management in cancer. And Dr. Christian Nelson, clinical psychologist, Memorial Sloan Kettering Cancer Center in New York, USA. Dr. Nelson's main clinical and research focus is on the sexual functioning of men following cancer treatment, with the primary aim of his research is to understand the emotional impact sexual dysfunction can have on men and to test the efficacy of psychological interventions to improve sexual functioning of men following cancer treatment. So thank you to all of our panelists, and we'll go straight into the basics with Jeff. Jeff, can you run through what exactly is survivorship?
Well, thank you, Ricardo, and it's a pleasure to be here. You know, a diagnosis of prostate cancer is a major life stress. It's a threat to a person's very existence, with the potential to impact on pretty much every aspect of that person and that person's family's lives. So after a diagnosis of prostate cancer, it's important for us to focus on that man living longer, but equally, it's important to focus on living well. And survivorship is about quality of life for these men who are diagnosed and for their partners and families and their friends once a diagnosis has been made. The physical and side effect issues, of course, and they are front and center. But in addition, it's also to remember the social, the emotional, and psychological impacts of this disease to ensure well-being. And we see that survivorship experience for men and their partners and families beginning at the point of diagnosis and continuing through their lives.
Jeff, I hope it doesn't sound like an obvious question, but why is survivorship important?
Well, Ricardo, it's critical, of course. And you say it's an obvious question, but it's an important question. When a diagnosis is made, cure right up front, a cure is an obvious priority. But so too, as we've just spoken about, is quality of life. And so too is living well. And survivorship care ensures that we make this a priority, that we understand it's an issue, and we focus on it. Right now in Australia, for example, there are approximately 220,000 men living out there who have been diagnosed with this disease. Every year, there's another 17,000 men approximately get diagnosed. Happily in Australia, we have one of the world's best 5-year survival rates for this disease. 95% of men in Australia who are diagnosed and treated for prostate cancer survive this disease at least 5 years. It's a wonderful figure. We of course want that to be 100%. But while we're working on that last 5%, it's important to know this is an impressive figure. What it means, though, of course, is with more men getting the disease and our treatments being so effective, we have more and more men surviving this disease for longer periods of time. For example, we estimate that in the year 2040, that 220,000 men living with disease will be more like 375,000 men. The numbers are going up. Survivorship has never been more important than it is now, with increasing numbers of men living longer. And our focus on survivorship needs to remain front and center.
Jeff, I guess one of the points of the panel discussion we're having today is what we can do to help or improve survivorship, right? We'll go into more detail in a few moments, but give us a run through of what can be done to improve survivorship.
All right, well, so the PCFA, the Prostate Cancer Foundation of Australia, has led, for example, the development of the Survivorship Essentials Framework for men diagnosed and treated for prostate cancer. And the purpose of this was to identify and describe key aspects of survivorship. Right now, men tell us, men throughout the country tell us that survivorship care in Australia is not well understood. It's fragmented in part, not well coordinated, that there are gaps, for example, in psychological care and exercise, and that where survivorship care is available, sometimes the quality varies. So the establishment of the Survivorship Essentials Framework was really about getting us all on the same page. Let's all understand what the key elements are of survivorship care. Let's understand why they're important. Be clear about priorities so we can set some targets in terms of resources and allocation. We can set some targets for our policymakers in terms of good public policy and care. And we can also set some targets and priorities in terms of service provision so that we can provide what we know to be evidence-based services to make the biggest possible difference in the lives of men with prostate cancer and, of course, their partners and their families.
Yeah, Jeff, that survivorship framework has come up with 7 priority actions for men with prostate cancer, which we'll talk about in detail in a moment. I want to go around the world right now and go and touch on the different points that everyone's going to make in detail. Firstly, John, perhaps. John, obviously prostate cancer is a men's disease. So what are the challenges with survivorship, especially in a gender sense?
Yeah, thanks, Ricardo. I think there's a few things we can think about. In terms of masculinities, it's often about roles, relationships and identity. And if you think about prostate cancer, what it tends to do for fellas is take them away from the identities that they've known as men, and that might be a threat to their job, to their work. Their roles as husbands might be changed, and their expression of intimacy might change around prostate cancer, and then relationships, how they're seen by other people, how they view themselves. So all of those things can shift in relation to a prostate cancer diagnosis. And then as you go through the trajectory of making treatment decisions, the chance of reoccurrence, survivorship, all of the things that go with those time frames can be very challenging in terms of those gendered identities are continuing to shift. And it's making adjustments, and it's also understanding that there can be some losses and some gains in this work of survivorship.
Okay, we'll go into more detail on that in a few moments. Christian, I guess a lot of the mental challenges are connected to sexual function, right? So what's your role in survivorship?
Yeah, so and thanks, Ricardo, and thanks Jeff for having me a part of this this call and this web series. I really appreciate it, and happy to call in from New York to check in with my friends in Australia for sure. And you're right, Ricardo. The mental challenges and impact of a loss of sexual functioning, or some type of impact on sexual functioning, can hit men pretty hard. And we'll talk about this more a little bit later. But ultimately, my role in survivorship is to help the man and his partner, through this journey of survivorship. And hopefully, what happens after treatment, that the cancer is taken care of, and the cancer is in the rearview mirror. And then what happens is dealing with the side effects of treatment. And my role is to help men, and again, men and their partners, really try to cope and develop strategies to deal with these side effects. One of which is the primary one is sexual functioning.
Okay, Chris, from New York, I want to go to Perth, where Rob's standing by. Rob, you focus on exercise. How crucial is exercise in survivorship?
Oh, thanks, Ricardo, and again to PCFA and Jeff, thanks so much for the opportunity to be involved in this really important webinar. Look, I'll say up front that it's pretty well established. The evidence is so strong that the relationship between being physically active and a 50% reduction in cancer-specific mortality. So a 50% reduction in your risk of dying of prostate cancer if you're just physically active. And that's a very well established association. But that's just for general physical activity. And that's so important. I think number one is that we have to ensure that men with prostate cancer are not sedentary. If they maintain a sedentary or adopt a sedentary lifestyle, they're greatly compromising their chances of surviving the disease, but also their quality of life will be diminished. And also, in particular, the side effects of treatment will be much worse. We know that physical activity really reduces treatment side effects. But when we go from there, we look at exercise. And exercise is a form of physical activity which is targeted and planned. And it's highly specific to address specific issues that the patient's going through. And there we're seeing application of exercise prior to surgery, for example, during chemotherapy, radiation therapy, during androgen deprivation therapy, a very large volume of research showing that we have greatly reduced side effects of those treatments. And then exercise being applied as a medicine, as a rehabilitative medicine after these treatments to help the man recover. And of course, it will also reduce the risk of recurrence. So we're seeing application of exercise as a medicine right across the spectrum, from first diagnosis, pre-treatment, during treatment, rehabilitative, and even now we're seeing it applied at the palliative stage when it's end stage of life as well.
Okay, Rob. Bogda in Adelaide, when we talk about survivorship and unmet needs, I guess we think of reoccurrence, anxiety or depression, but other unmet needs aren't as apparent. So what do you focus on?
Well, Ricardo, it's well established that issues that cancer survivors face do not occur in isolation. Many of them would have other health conditions, other social challenges that they're facing, and good survivorship care really needs to connect all those different issues that patients deal with, in addition to the challenges of prostate cancer that in fact make those pre-existing conditions more challenging and more severe. One example is the issue of cardiovascular disease in cancer. Cardiovascular disease is quite common in most populations. In Australia, about 1 in 5 of individuals who are older than 45 years of age would have a high risk of cardiovascular disease long term. And we know that in prostate cancer, the risk of cardiovascular disease after cancer is worse if pre-existing cardiovascular risk factors occur. So there is an interaction between pre-existing conditions and the diagnosis of cancer and the prostate cancer treatment. And as a result of it, we need to manage consequences of prostate cancer, but also consequences of coexisting cardiovascular disease that may impact on quality of life and potentially survival. And those issues are often difficult to manage because risk factors as such are not a disease, so they may not be visible, or they may be ignored because there is so much focus on the cancer and cancer treatment. And in a setting of the pandemic, people may not seek additional help to address them. And at the same time, as Rob has already pointed out, we have so many solutions to address risk factors with physical activity, exercise, diet modification, etc. So my role is trying to connect the dots and making sure that in addressing problems of relating to prostate cancer, we do not forget all the other things.
Bogda, we'll go into detail on those in a few moments. Jeff, just to bring it back to you before we go into detail on all those points, you touched briefly on that survivorship framework which has been developed. Maybe can you go through it a bit more and explain why it is important?
Sure, and thank you, Ricardo. And again, it's a very important part of managing prostate cancer in our community. Look, our objective with the survivorship framework was to find an evidence-based approach to deliver survivorship care, quality survivorship care to every man and their families when a diagnosis has taken place. So what we set about a task over a period of time where we reviewed all the literature, we established what the evidence was, we consulted with men throughout this country and abroad on their survivorship issues and to receive their feedback. We consulted with healthcare teams, with doctors and nurses and allied health professionals. We consulted with health service providers, both government and non-government, to make sure that we understood what the issues were. And then through a consensus approach, we set about determining what the essential elements of a survivorship framework should be, a framework that we can all work together on. So the framework includes 6 essential elements, and you've mentioned, Ricardo, 7 priority areas, and they are priority areas for the PCFA to pursue. But what I'll do quickly then is, first up, is look at the 6 essential element areas, and they are, in summary, health promotion and advocacy. And this one's about ensuring men have access to up-to-date information so that they can understand issues, understand circumstances, and make choices which suit their own circumstances. The second element is shared management. And this assumes the importance of men being engaged as equal partners with the healthcare team, being involved to the extent that they are comfortable in decision-making about their treatment. The next essential area is vigilance, which is interesting in a survivorship model, but it really speaks to the importance of clinical surveillance and responsibilities in this regard after a diagnosis of prostate cancer has been made, but across that survivorship continuum, not just at the point of diagnosis and not just at the point of treatment, but across that survivorship continuum, and once again recognizing the physical as well as the social, emotional, psychological, and contextual issues, which Bogda just referred to there in a more broadly based approach. Personal agency is the next element, and this really speaks to supporting men to be self-aware and proactive in their own healthcare after a diagnosis and treatment, to identify potential sources of support, to know themselves about actions that they can do, and to be a proactive team member. The next is care coordination, and this hopes to ensure that the healthcare team works well together, that men and their family members don't fall through gaps. The best possible care to be provided in the right place at the right time is a phrase that is sometimes used. Providing the best possible care in the right place at the right time for individual men and their family members. And the sixth, essential in the framework is evidence-based interventions. Look, you know, we want this framework to promote support services and programs where there is proof that they're effective. And we've heard a little bit about some of those already, about exercise, about nutrition. We know that there are others, for example, about peer support we know that works. There are certain psychological interventions which Chris has spoken about and will speak more about, which we know work. We also know that, you know, access to a prostate cancer specialist nurse in terms of information and guidance can be critical as well. And they are evidence-based interventions where we know they work. So let's focus our attention on those things to make sure we target these things properly. Now, in addition to those areas, and you've mentioned them, Ricardo, and I'll briefly touch on them, in response to that, the Prostate Cancer Foundation of Australia has identified, with support of our networks, our health professionals and men who have been diagnosed, 7 priority areas which we're working on right now, which are about enhancing patient clinician communication, developing a survivorship toolkit, which is available to men throughout the country, growing the availability of multimodal care. I think we've spoken about the importance of making sure that there's a healthcare team involved in this, that men engage, to look at reducing out-of-pocket expenses. So financial well-being is an issue as well, and we need to address that as far as we can. Promote the uptake of physical activity as a major priority. And Professor Rob Newton will talk to you about the evidence, which is so very strong about exercise, and it's important for us to get that out there. Harnessing technology, and in our post-COVID era, we're all looking for ways to harness technology to deliver healthcare in different ways, clever, innovative ways. And certainly that's our priority with regard to delivering survivorship care as well. And once again, to build the capacity of outreach specialist nurses to make sure that every man diagnosed with prostate cancer in the country, no matter where they are, can have access to a person who can assist with information and guidance.
Okay, Jeff. So what we are going to do now over the next 40 minutes is delve into the expertise of our guests today. And we've got 4 clear ones: exercise, cardiovascular, mental and masculinity, and psychological and sexual health. And we'll probably give our guests about 8 to 10 minutes each to talk about these in detail. So how about we start with the physicality of things first? So Rob, with exercise, and as we mentioned, and as Jeff said, promoting the uptake of exercise is one of those 7 priority actions in the essential framework. So Rob, is any exercise better than none at all?
Oh, Ricardo, absolutely. I mean, the human species is required to be physically active on most, if not every day. That's how we've evolved. And the majority of chronic disease that is causing mortality and morbidity across the world, whether it be cancer or cardiovascular disease, metabolic syndrome, type 2 diabetes, the majority of it is driven by the fact that we just don't move enough. That's the underlying cause, and inappropriate nutrition. So the number 1 point is that you have to be physically active most, if not every day of the week, just to maintain normal function. Now, what we're seeing now is, because unfortunately in Australia, around 2/3 of the population aren't sufficiently active, and then so they're having all sorts of interruptions to their normal physiology, and boggling to speak, to the massive amount of cardiovascular disease that we're now experiencing. But when you lay cancer on top of that, and then the treatments for cancer, then all of these issues are exacerbated, and most men won't die of prostate cancer. They'll die of some other chronic disease, and predominantly cardiovascular disease. So any sort of physical activity will help to reduce that risk. But we can do much better than that. And as Jeff's pointed out, there's a huge amount of research now in exercise medicine, and we're really changing the guidelines. And last year, we released a position statement on exercise medicine in cancer management for Australia. And my colleagues and I recommended that we take a much more targeted approach, where we determine what are the priority health issues, whether it be heart disease or metabolic syndrome, type 2 diabetes, and then specifically design an exercise prescription to reduce that risk, because that's the priority, because that's what's going to cause the greatest morbidity and mortality risk for the patients. So any exercise is better than none, but we can do a lot better than that with targeted exercise.
Are there certain types of exercise, though, that could be dangerous for prostate cancer survivors?
Oh, absolutely. Once again, it is about prioritising the exercise, but also whilst managing risk. Now, I have to point out that there's now been thousands of exercise trials completed in cancer. And the reports of adverse, particularly serious adverse events from those exercise interventions is extremely low. It's highly unlikely that someone is going to have a severe reaction, if you like, or injury with exercise. But certainly there's certain types of exercise which are going to be more effective than others and should be recommended. So as an example, we're seeing that men who are on androgen deprivation therapy are experiencing a lot of toxicities from the treatment, in particular muscle loss, fat gain and bone loss. And so in that instance, the target we published into last year for the first time demonstrating that a particular type of exercise called impact exercise could actually totally prevent the bone loss. So it is about specific exercise. It's not so much that certain exercises will be dangerous, it's just that certain exercises just won't be effective at managing particular issues that the man's facing.
And how do you measure fatigue, I guess? Because how do you know if you should push through it?
This is one of the major problems, of course, that men face. The androgen deprivation therapy causes considerable fatigue, as does radiation therapy. And this is reported as one of the most problematic side effects of treatment, this overwhelming fatigue. But it's different fatigue. It's not fatigue that you have from a long day working in the garden or from a day at work where you're really concentrating. It's a different type of fatigue. It's fatigue which is actually physiological. And to a large part, it's because your systems are impacted, are compromised. And so the strategy which has been proven to be effective is actually to exercise, which seems counterintuitive, but what it does is it enhances the capability of the neuromuscular system, the cardiovascular system, so that all tasks are somewhat easier, and so that this helps to manage the fatigue. But it is important that when you are experiencing this excessive level of fatigue, which tend to oscillate over the day and over the week, then when it is really impacting you, yes, it's important to try and back off a little bit. But when you are feeling a little bit more lively, a little bit less fatigue, that's the time to just push a little bit harder with the exercise, because what we see is that you get these lovely endorphins and cannabinoids, so cannabis-like compounds released into your body, and that really, those drugs, those internal drugs, that exercise medicine, really helps to counteract the fatigue.
I guess a new complication is COVID-19. So how does that complicate exercise right now?
Well, it's difficult because in many parts of the world and many parts of Australia, face-to-face exercise supervised by an exercise physiologist or a fitness instructor is not possible. And what we've seen is that with men, for example, with prostate cancer, and we have many hundreds of patients that we're supporting at any given time, is that they're confined to home. It's difficult for them to exercise in a controlled environment. We have used technology to actually pivot all of our programs, and so we're supporting these patients with online exercise prescriptions that they can access through their smart device, tablet, or through their web browser on their computer. We're using video conferencing, as we are today for this webinar. We're using that extensively, so our exercise physiologists can monitor the men whilst they're doing their exercise program. And we're even running group exercise programs where men can join up on the various video chat programs to exercise together, because that's very, very important, that peer support. I think the key issue is, just because of COVID, you cannot adopt a sedentary lifestyle. If you do that, all we will see is all the other chronic diseases that you're experiencing are going to take off. And we're going to have a tsunami of problems here with type 2 diabetes and cardiovascular disease, basically being driven by the changes in behaviour enforced on us by COVID-19. So it's very important to exercise. Another key aspect which we're looking at is exercise is very, very important to maintain the immune system. And being physically active and having cancer could be the difference between your experience of COVID, whether you actually contract COVID in the first place, and secondly, what your actual experience of COVID will be like. And the latest research coming out is showing that being physically fit actually increases the effectiveness of vaccination. So if and when we have a vaccination for COVID-19, I don't know about you, but I'm exercising every day to make sure that my body is really tuned. The immune system is very much tuned, so that when I receive my vaccination, I'll have the greatest uptake and effectiveness of it.
Rob, just finally, you mentioned the word exercise prescription a fair bit in the past 5 to 10 minutes. I'm guessing that kind of also means an exercise plan. So how do you go about getting one, and how much does it cost?
We're very fortunate in Australia, and my apologies to our Canadian and US colleagues on the call today, but in Australia we have what is called a chronic disease management plan, and this is a plan which is designed by your general practitioner. It can't be done by your urologist or your oncologist. It has to be done by your primary care physician. And what they can do is they can refer you for up to 5 consultations with an accredited exercise physiologist. Now, in Australia, we're very fortunate that we have this allied health professional, which is the most qualified and experienced allied health professional for the assessment of a patient around their fitness and health, and then the prescription of a targeted exercise program. More and more in Australia, we're seeing these accredited exercise physiologists, or AEPs, specialising in cancer management and support as part of a multidisciplinary team. And so if you go to the website, which is Exercise Sports Science Australia, or you just search in your search engine, Google, find an exercise physiologist, it will take you to a website. You can put in your postcode in Australia. You can select cancer as a specialty, and it'll pop up all the accredited exercise physiologists in your local area. From there, Medicare will support up to 5 of your consults with that exercise physiologist, in which they'll develop a tailored, targeted exercise prescription, which is specifically will address the morbidities, the issues that are most impacting you in your prostate cancer journey.
Okay, thank you, Rob. Exercise and I guess heart health goes hand in hand. Bogda, speaking of COVID-19, do you think it has prevented survivors from perhaps looking at or getting on top of other complications like cardiovascular disease?
I suspect so, Ricardo. When we look at the data from Australia, UK, and other countries, there is evidence that during the pandemic, the attendance at general practitioners' visits have reduced. The attendance at screening programs for cancers have dropped, as did emergency department attendances. So we know that there is less seeking of medical advice. And while most of the data relates to screening for cancer, for example, I think the same could apply to management of other conditions. And there are really 3 reasons for this. One is that people are frightened of attending health services where they're more likely to be exposed to the virus. Secondly, they do not want to bother health practitioners who might be busy attending to more severe cases or dealing with the virus itself. And thirdly, there have been significant limitations to access. So there was certainly in Australia a period of time when patients couldn't access face-to-face visits, but really could only attend through telemedicine consultations, and getting an appointment with the GP was harder. Now that we're realizing that this data is coming through where people are not seeking medical attention, we really need to turn it around. And tremendous opportunity here is harnessing the benefits of telemedicine, because it is an opportunity to improve access in a safe way. So it addresses 2 of the barriers. And really, if we could augment it by highlighting to people that their care is important and their healthcare needs are important, and we are here to provide services, then we would really be addressing the 3 main barriers why the attendances at the moment are dropping. So the key message is, if you have health concerns, if you have other comorbidities, please do not neglect them because of the pandemic. We do not want a tsunami of problems that are left behind way too long later. We can manage things now, and we want to manage them because we're likely to have better outcomes if we address them earlier.
Bogda, earlier you mentioned about the seriousness of cardiovascular disease as we get older. So how can we raise the awareness of cardiovascular disease in cancer in general, and more specifically prostate cancer?
I think really we need to start by reframing the discussion. Traditionally, people look at cardiovascular disease in cancer as a rare but important complication of cancer treatment, meaning something that really affects the minority of people. And then we try to reassure ourselves and reassure the patients that because it's only a minority, it's not a big deal. If we were to look at it from a completely different angle and realize that majority of Australians have some form of cardiovascular risk factors. You've already heard from Rob about inactivity and obesity, and these are some of the most common risk factors. That means that the business of reducing cardiovascular risk factors and cardiovascular disease applies to majority of people with cancer. So I think that we really need to reframe what we're talking about. And the second thing is we really need to build it as a core element of good survivorship care. So when nurse coordinators talk to patients about what are their priorities, they can consider other comorbidities and other risk factors and build a clear plan of what can be done to reduce the risk and manage this as a holistic approach to health, where we're managing the cancer as well as everything else that is relevant to cancer.
You've mentioned the word management there. So maybe if we can touch on management techniques, why is shared management important or valuable? Who is doing the sharing and how do you support it?
This is where shared care involving general practitioners is really important, because they have phenomenally well-developed skills of management of risk factors for chronic disease. They know about chronic disease management plan. They have access to services that might be beneficial to patients. They focus on lifestyle management. So GPs are really well equipped to address these aspects of survivorship care. And in fact, it gives them a very important role that other healthcare providers that manage prostate cancer, like medical oncologists or radiation oncologists or surgeons, are not very good at. Secondly, GPs play a very important role in the care coordination. So they really can pull together all the diverse aspects of healthcare management for the patient, take into account what are the needs of the family that supports the patient, what is available in the community. So they play a very important coordinating role in putting together all those different elements of care.
Okay, Bogda, so we spoke a lot about exercise, heart health. I want to move over now to the mental and masculinity side of things with John. John, maybe from the basics, what is the difference between anxiety and depression, and how do those challenges most often connect to prostate cancer?
You know, in the simplest of terms, anxiety usually relates to worry about the future, and depression is usually about the past and concerns about the past. So if you think about it in terms of prostate cancer, we see bumps in anxiety risk around being diagnosed and then waiting on a treatment decision or waiting for a treatment, for example. We see some depression around, peak around decisional regret. If someone feels that they rushed into a decision, had a treatment, and are grappling with the aftermath of some of that. So I think, it plays in different configurations, anxiety and depression, across the trajectory. I think it's really important to be aware that that guys with prostate cancer are far more at risk than the general male population, age matched, for both of those things, anxiety and depression.
And gender-wise, do men deal with prostate cancer, I guess, any cancer, I guess, when we compare them with females, and how does one adjust to that? Yeah, I'm sure that there are differences that relate to how we think about gender and how we embody that. I would just say that in the context of prostate cancer, some of the things that we see, so for depression, for example, we often see guys manifest as anger, irritability, alcohol overuse, risk-taking, and those sorts of things we don't always see in females, and it doesn't always have to be about difference, but I think what it does need to be about is being cued that male depression might actually look different. And in relation to prostate cancer, there's those kind of issues pop up
around, you know, the anger for why me, in a disease where it's not necessarily directly linked to lifestyle, you know, or anything that they did. So lots of things come up for guys. So I just say that, you know, maybe depression is one to think about in terms of differences in how it manifests in the men with prostate cancer and men more generally, to be honest.
John, you just mentioned that depression may look different. So how do you identify it, and how do you support men who I guess are in more of a darker place?
Yeah, so one of the things that you can do with guys is you can give them permission to talk. So we oftentimes have this misconception that guys don't talk. We talk about stoicism all the time, and time and again we've seen it where if you create the opportunity and the permission for a guy to talk about what he's feeling, chances are he will. And then you can build on that. So oftentimes it's not a full-blown depression, it's just depressive symptoms that they're going to work through. And this is, if you think about prostate cancer, it's like injury. And the thing that a lot of guys do is drive injury internal. And so if you're able to reach out and, you know, be in contact with someone, just ask them how they're doing, how they're really doing, and work with them to articulate what's going on for them, it can make a huge difference because it forces them to externalize what's going on for them rather than driving it internally. And then the third I is they isolate. So when they go internal, you know, they often isolate from others. So reaching out to guys can be, you know, such an important piece of providing help.
I guess there are many services out there that can help, but if anyone that is watching this webcast right now and wants to speak with someone immediately, you can call Lifeline on 13 11 14. So Lifeline 13 11 14. John, before I let you go, when we talk about any aspect of prostate cancer survivorship, is there anything that Australia can learn from Canada where you are, or the other way around, something Australia is already better at doing than Canada?
So I'm bicultural, right? So just to say, I think there's been some really great things happen in both countries, and I've been fortunate enough to be up close to a few of those. I just want to give a shout out to the prostate cancer support groups in both countries. Amazing work. They volunteer run, you know, really provide the opportunity for guys to seek counsel from other fellas who've been through it, who've been working their way through it. We in Canada attract about 30% of the people who go to prostate cancer support groups are women, you know, women partners. So again, it's so interesting. These places provide a lot of help to people, and I just encourage, you know, both countries to keep going with that work. It's so important. So I wouldn't, you know, say one's better than the other. They're both doing a very, very good job in the survivorship space in community-based with those support groups.
Okay, thanks, John, for that. We're going to go from, I guess, anxiety and depression, and I assume one of the reasons why we see a lot of this is because it's connected to sexual health. So, Christian, if I can bring you in now, to what extent does prostate cancer treatments impact men's sexuality, and how common is it?
Yeah, and so a great deal actually, and you know, really, if you think about any treatment, whether it's surgery or radiation to the pelvic region, there's most likely going to be an impact on sexual functioning, and really kind of for the early stage treatments for prostate cancer, the surgery and the external beam radiation, really what we're talking about is an impact on erections. And most men report that they have difficulty with erections after these treatments. And if you look at the literature, that the figures around 85% of men will report some type of difficulty with erections after treatments. And so if you think about that 85% of men, and it's virtually everyone who has these treatments, and the other 15% often report some type of loss of sexual satisfaction. And so ultimately, you know, it's so common that really it's, if men after treatment are experiencing it, it's unfortunately a part of the treatment.
And how do you distinguish between whether it's psychological or whether it's physical, and how do you overcome that?
In terms of the impact on sexual functioning?
Correct.
Is that, yeah, and so, I mean, so ultimately you know, if you weren't talking about treatments for prostate cancer and you're talking about difficulties with sexual functioning for men and erections, then you would tease apart the psychological with the physical. But oftentimes, after treatments with prostate cancer, the really impact on sexual functioning starts from the physical impact of the treatments. And then ultimately what happens is that does roll into an emotional impact on the men and on the partner. And so many men will talk about, like, if they have difficulty with erections, they'll talk about that it goes to the core of what it is to be a man. They'll say that, you know, in terms of John's talking about masculinity, they'll talk about the loss of their masculinity. They'll report things like irritability and feeling down, and really it's not just in the bedroom. Oftentimes men will talk about a loss of self-esteem, that they just don't have as much energy or as much enthusiasm for life anymore. And then what happens oftentimes is that for men, if they have difficulty with erections, they might pull back with non-sexual intimate contact. And really what I mean by that is things like sitting together on the couch with their partner, or holding hands, or hugging, or just spending time with their partner. And ultimately what happens is men pull away from their partner. And then what happens is that's when the partners really feel it. They feel a disconnect. And then what happens is that the men's stress turns into stress with the couple, and stress between, you know, the man and the partner, impacting basically both of them.
Chris, so how do you restore or maintain a sex life following prostate cancer? And are there any effective treatments?
Yeah, and this really comes down to two things. One is physically, how can we help men get their erections back? And then from a psychological relationship perspective, how can we help men and their partners use these treatments to help get their sexual relations back and their sexual life back. And so in terms of treatments, in terms of the physical aspect and helping get erections back, we have really effective treatments for it. And it's a positive in this area, because oftentimes side effects of cancer treatments, you might not have really good treatments for those side effects. But here we do. So there's the pills, there's the Viagra, Levitra, Cialis. That's generally what men try first. For men who've had prostate cancer surgery, right after surgery, in the 3, 6, 9, even 12 months after surgery, those pills might not be effective, because the surgery, what's happened is those nerves responsible for erections, the surgery has basically injured those nerves intraoperatively, and those nerves need time to heal. And the pills actually work off of those nerves. And so those nerves are healing, the pills might not necessarily be effective. But then there are other treatments other than the pills. And so many men who have explored this after prostate cancer have heard of what's called penile injections. And if you haven't heard of those before, it's kind of a shock for men, thinking penis and injections. Those two generally don't go together, but ultimately what it is an injection in the shaft of the penis with a very thin needle. And pain on injection depends on the thickness of the needle. So the thicker the needle, the more pain; the thinner the needle, the less pain. And it's a thin needle, generally in the shaft of the penis, which delivers what's called the vasodilator into the shaft of the penis, producing erection. And it actually is really one of the best, most effective treatments for erections that we have, and it works really well, even for men after surgery and after radiation treatment. And so there are these treatments available, and it's important to talk to a urologist, one who specializes in sexual functioning or sexual medicine, to help with these. But ultimately, they work, and they generally can work well. And so getting the physical piece back is that first step. And then the second step is actually for the man and the couple to really to enhance the communication, to be able to talk about kind of the stresses and the difficulties that are going along with this, to be able to integrate those treatments into sexual relations. And ultimately, kind of as I worked with couples throughout the years, I mean, any couple after prostate cancer surgery who's wanted to have a quality of sex life has been able to figure it out. Now, it may be different. It may be different than what it was before before you heard prostate cancer and before prostate cancer treatment. But ultimately, ultimately with some work and some communication and some trial and error, couples are able to figure it out.
You mentioned some of those treatments, and we here at the Prostate Cancer Foundation of Australia did do a whole webcast on sex, intimacy and relationships, going into detail. So if anyone's interested in finding out more after this webcast, just go to the videos section on the online community of the Prostate Cancer Foundation of Australia webcast and search for that sex, intimacy and relationships webcast. Chris, you also mentioned couples there. Any specific advice for couples and sex after prostate cancer?
Yeah, and kind of the one piece of advice is just, understanding that man as a partner may be communicating on different levels and about different things. And essentially essentially what happens is this: a man talks about and potentially talks about how distressing it is for him and how difficult it is for him, talking about maybe how he's pulling away. And then the partner, trying to be supportive, says, well, it's not such a big deal to me. You don't need to worry about it. And even though the partner's trying to be supportive, what a man hears is that, wait a minute, it's not such a big deal to you? Like, I found out this is really a big deal to me. It's kind of, again, it's kind of core of what it is to be a man. And then oftentimes that can start conflict because the couples seem to be communicating just on different levels. And so the real important thing is to try to have some open communication. Try not to jump to conclusions. Try to be patient with each other, and just continuing to talk and communicate. Again, through trial and error, figuring out how to use these treatments and how you as a couple can best integrate them into the sexual relationship.
Christian, what if you're not in a couple and you're a single man? How do you date? How do you look to start a new relationship after prostate cancer treatments?
Yeah, I work with a lot of single men, and they come in and they say, they think that, they basically say, I'm done, right? So this is, I've had this treatment for prostate cancer, worked really well, but it's left me with erectile dysfunction. I'm single, and I just will never have another relationship. And ultimately, those are the thoughts that go through men, many of the men who are single after prostate cancer treatment. But ultimately, kind of, men can really have success dating after prostate cancer treatment. One, physically using the treatments to help get the sexual functioning back and erections back. And then really it's about having the courage actually to continue to date, to communicate about what's happened. And ultimately, my experience, I've worked with a number of single men after prostate cancer treatments. And every man who's really wanted to pursue a relationship has been able to do that. And so there is definitely hope. It's doable. It takes a little bit of work and a little bit of patience, but it's definitely doable.
Okay, I want to bring it back to Jeff to wrap up, but I don't want to put all of our other guests on the spot. However, I will ask each of you for a 30-second key takeaway in just a moment, so if you can get ready for that. But Jeff, just to wrap, what are the essential elements when it comes to survivorship? Jeff, I think you might be on mute.
There you go. Trust it to be me who had struggled with technology, Ricardo. Apologies to our guests. Look, first up, if we're getting to wrap up, if I don't get a chance later, to acknowledge Ricardo's expertise in these matters and also the quality of the panel. We have an international panel here from all parts of Australia and abroad. So it's terrific to bring this expertise together. We've touched on essential elements, and what we pointed out is that survivorship is an important part of managing prostate cancer for the men themselves, and of course for their families, friends, and partners. And it's also something which we need to look at on a number of levels, about information and health promotion, about evidence-based intervention, so we know we're doing the right sorts of things, about personal agency and taking responsibility yourself, about vigilance from the healthcare team and those around you, coordinating our care to make sure men don't fall through gaps, and wherever possible to look for shared management. And through all that, by having those targets, by understanding what the framework is, we can actually start to bring people together We can bring governments together, clinicians together, health systems together, service providers, charities, people in the community can come together because we've got a set of targets. And by way of just picking up a point from Professor Olive, you know, when he mentioned support groups, I mean, the Prostate Cancer Foundation of Australia began from and is intimately linked to support groups around this country. And, you know, peer support has been and remains, you know, one of those evidence-based interventions. We know that the power of shared personal experience, in this case, when it relates to a diagnosis of prostate cancer, can do things that no trained professional can do. Just that shared experience. Our support groups do a great job around the country, our peer support programs as well. And I just do want to acknowledge in this webinar the long-standing advocacy and intervention work that our men with prostate cancer and our support group leaders, the work they do every day.
Okay, thank you, Jeff. I'm going to do a quick wrap around the virtual room. So a key takeaway, first of all, Professor Robert Newton, what do you want viewers to take as their key takeaway?
Well, thanks, Ricardo. And again, thanks for the opportunity. It's been fantastic. Look, number one, I would say is that if you have prostate cancer and you are sedentary, you need to get moving. You are compromising your quality of life and potentially your quantity of life. If you're experiencing difficulties, in particular, chronic disease risk, cardiovascular disease, type 2 diabetes, get yourself along to your GP, talk about developing a chronic disease management plan, combination of exercise and some dietary support there and counselling to help you improve your quality of life, and all the evidence is that it will actually increase your survival.
Bogda Kozwara, your 30 seconds.
See your health as a whole and address all aspects that need addressing.
John Olive, what do you think is your key takeaway?
Yeah, just to say that masculinity can be strength-based. Men do a lot of things very, very well in terms of problem solving, in terms of admitting vulnerabilities and the courage to seek help and work their way through. And I just wouldn't want to underestimate that. You know, we see a lot of guys do a lot of very, very good work in survivorship, and we see a lot of power couples, you know, do excellent work in terms of survivorship as well. So I just want to, you know, leave it on a nice upward tick with that. And as far as gender goes, sometimes it gets a bad rap about being deficit based. It's not. Okay, and Dr. Christian Nelson, you've got the final word.
Yeah, and so we know that these treatments cause difficulty with sexual functioning. We know it impacts men, but we can help. And there's organizations like this who are here to help and explore those treatments. We know there might be some frustrations along the way, but if you keep working and keep trying, most men will be able to have success.
Fantastic. Thank you very much to our panel, Professor Jeff Dunn, Professor Robert Newton, Dr. John Olive, Professor Bogda Kozwara, and Dr. Christian Nelson. Thank you very much for your time. And thank you to all of you tuning in to this Prostate Cancer Foundation of Australia webcast. If you did join late, it will be uploaded on the community section of the PCFA website at a later date. But remember, the website has plenty of other information and resources to help you gain even more knowledge. I'm Ricardo Gonsalves. I'll see you next week.